Hello, my name is Adina Munin, and today I'm here with my father, Michael Munin. Dr. Munin graduated Thomas Jefferson University Medical School in 1988 and is now a very talented physician who specializes in the Department of Physical Medicine and Rehabilitation at UPMC. He's also recently been working as a professor and vice chair of clinical program development at the University of Pittsburgh School of Medicine. Let's face the facts. You've won numerous awards, such as Excellence in Teaching in 2011, and you were part of the list of Best Doctors in America from 2003 to 2015. You're now working at Pitt as well. My question is, where did you start? Did you know you wanted to be a doctor, like, right out of college?
I would say I knew I wanted to be a doctor before college. As a high school, maybe 11th grader, I would say I pretty much had made the decision, and in fact chose a college that was a pretty small college at the time, West Chester University in the eastern part of the state, and it had a very selective but really special program for students who wanted to go into pre-med. It was half of the chemistry, half of the biology degree requirements combined together for a chem-bio degree, and it was really well focused and achieved the goal of getting me into actually numerous good medical schools. My father was a dentist, and so a health professional, so that kind of gave me an interest in the health professional career path. And he actually thought medicine was a better career path than dentistry, believe it or not. He actually didn't want me to be a dentist. And so with my interest and his guidance and pushing, maybe pushing is a strong word, but his advisement, I went that way. And we, again, we knew actually that the head of the West Chester pre-med program, named by a guy by the name of Philip Rudnick, and my cousin Roger Sharp actually had gone through the program several years earlier, and he got into Temple Medical School. So through that background, I found that program, and again, I thought it was a great program for me to meet my chosen career path.
Okay, so after learning through college and after learning through medical school, how did you know where to start after medical school, like how to find a job?
Well, that actually starts in the middle of medical school, really, because you have to know what you want to do after medical school, because the training could be anything, from a surgeon training to a internal medicine training or my chosen career. And the way I found my career was, I think, kind of an interesting story. In my sophomore year, in between the first session, the first semester and the second semester, there was a small intersession, so to speak. And I did a clinical rotation, meaning it was with patients, because up until that first 2 years, it's all pretty much classroom work. I then pursued some electives in my third and fourth year in physical medicine and rehabilitation. And then eventually there's something called the match, kind of like a dating game for young doctors and career paths. And I went into the physical medicine and rehab match, and eventually matched at Jefferson Department of Physical Medicine and Rehabilitation at Thomas Jefferson University Hospital.
So then once you start actually working there, did you first start off like shadowing other doctors, or did you start like very low with like simple tasks?
Well, in your third years, when you start doing what's called your clinical rotations, you're in the patient arena, so to speak. And there you're working with the residents. It's kind of a chain of command, almost like a military chain of command. You have the generals, lieutenants, and the sergeants, and the petty officers, so to speak. Well, the students work with the residents, and they give you assignments. You look things up. You work with just a few patients at a time, and you get to know them very well. And then you progress during your senior year as a medical student, and you do like an acting internship where they give you a lot more responsibility. And then when you graduate school, you do an internship. I actually did my internship here in Pittsburgh at Allegheny General Hospital. And that's when you really get a full caseload. Again, you're still supervised by other residents and the attending, but really you're doing a lot of work. You really have a lot of responsibility. That's when you really are a doctor for the first time in your life, really. And then from there, after that 1 year, I went back to Philadelphia to start my physical medicine and rehabilitation training.
Okay, so you found a job. Now, once you are in this job, are there any steps or rankings that you have to build up to become where you are now?
Well, I'm a little bit unusual in that I only had one job my entire life. Because when I graduated my residency training from Thomas Jefferson in Philadelphia, I was hired in Pittsburgh. And I guess to answer your question, I got to tell you a little bit about the background of how I was hired. At the time, the division of physical, we weren't even a department, we were a small division. I was the third person, and we were a little offshoot of orthopedic surgery department. So there were just three of us. So we started to, or there's three of us, now we're an academic, our own self-department, and we have over 100 probably employees of various degrees, MDs, PhDs, etc. So to get that level of advancement through your career, it really takes a long time. In the academic environment of which I practice at University of Pittsburgh School of Medicine, you start as an instructor. Once you pass your board examination is like your big final exam certification test. It says, yeah, you really are an expert in that particular area. Then you become an assistant professor. And I was an assistant professor for about, I'm going to guess, maybe 7 or 8 years, maybe 8 years, something like that. And then you get promoted to associate professor. And I was an associate professor for another 8 years, until maybe 16 years into this job, where finally I got promoted as a professor.
How challenging was it to go through all the steps leading up to professor?
I think the challenge is you don't see it day to day because it happens over so many years. It's really a matter of just putting in the time and effort, and you have to then submit an application to the Office of Faculty Affairs or the Dean's office. I'm not sure, I forget what office you submit it to. And then a committee actually decides if you've met the criteria for promotion. So because of that, I guess the only heightened drama is after you submit your packet of information, waiting to hear back from the committee.
I just wanted to know how many years did it take? How long did it take for you to get to where you are now?
Well, I would say from an instructor level when I was first hired to the professor level, so we do the math, that's 11 years, and I was hired in 92, so that's 8 years, so probably close to 18, 19 years it took to become a full professor.
And nowadays, is it hard to maintain both jobs as a professor and then also working as a doctor?
Well, in some ways they're one and the same, because I do about maybe 30% of my time is research and administration, and 70% of my time is clinical, doctor-like work. Although my doctor-like work, I work with a lot of residents. Again, these are not students, but these are physicians who have graduated medical school who are learning how to do what I do in physical medicine and rehabilitation. So I supervise them in the 70% time of my clinical work and teach them how to do the field. I see patients and I take care of them. But the 30% of my time is the research time. That's probably a little bit more unique than just the average physician who's practicing in the community.
Do you think you've become more of a social person by interacting with your patients all the time? Do you think it's given you social skills just in everyday life?
I would flip it. I would say that you have to be a social kind of person to interact with patients and to get along with them well and to develop rapport over 23 years that I've been doing it. I think I'm very relaxed and I can really make people feel comfortable. I can look in their eyes and give them, even if it's a 5, 10, 20-minute interaction, I think we can get a lot done and they can feel comfortable speaking with me. And I think those are people skills that you either have or you don't. While some can be developed, I do think a lot of that is innate.
So obviously you're very well-knowledge in all of this and you've had a lot of experience in this field. So finally, is there any advice that you'd like to give to a future medical student who wants to ultimately become a professor?
Well, it's a long road, and you don't just become a professor because you're a good person, you have a nice smile. It's a lot of hard work. You have to follow some type of academic path. It could be teaching and preparing teaching modules for students or residents, or in my case, publishing papers and doing research. And I was awarded a Best Paper Award in 1998. So you have to get some of those honors along the way. You have to get grants. Grants are essentially, a monetary award that allows you to do the research, because research costs money. And you can't just say, I want to do research. You have to kind of get the grant, have a good idea, have other people review your idea. It's not as easy as just hanging around for 19 years, because while you can get maybe a promoted from an assistant professor to an associate professor, usually you have to have some level of expertise to kind of push it into a full professor.
Okay, so you're saying you really have to love what you're doing and really dedicate yourself to become where you are now.
And I think no doubt to that.
Okay, so thank you for joining me.
Well, thank you for having me.
This has been Interviews with Adina.